Carcinogens: nickel, chromium, beryllium, silica. Source: occupational exposure, factories, metalwork, mining, construction. Mechanism: inhalation of these particles causes chronic inflammation, oxidative stress, and DNA damage in lung tissue. Organ affected: cancer caused, lung cancer, especially in workers exposed long-term without protection. USMLE Question 1. A 55-year-old man works in metal processing and has a 20-year history of exposure to chromium and nickel dust. He presents with chronic cough and weight loss. Chest CT shows a mass in the upper lobe. Biopsy confirms non-small cell lung carcinoma. Which of the following best explains the cause of his cancer? A. Infection with oncogenic viruses. B. Chronic occupational exposure to heavy metals. C. Asbestos exposure. D. Inherited mutation in RB1E, silica-induced immune suppression. B. Chronic occupational exposure to heavy metals. Long-term exposure to nickel and chromium is a known risk factor for lung cancer in industrial workers. Why not the others? A. Incorrect. Oncogenic viruses are linked to other cancers, e.g. HPV, EBV, not lung. C. Incorrect. Asbestos causes lung cancer, but he works in metal, not construction. D. Incorrect. RB1 mutations cause retinoblastoma and osteosarcoma, not lung cancer. E. Incorrect. Silica causes lung inflammation and cancer, but immune suppression is more linked to TB risk. USMLE Question 2. A construction worker with long-term exposure to silica dust presents with worsening dyspnea. Chest imaging reveals a lung mass. Which of the following complications is associated with his occupational exposure? A. Hepatocellular carcinoma. B. Esophageal squamous cell carcinoma. C. Lung cancer. D. Bladder transitional cell carcinoma. E. Colon adenocarcinoma. Correct answer C. Lung cancer, silica exposure, e.g. from mining, sandblasting, or construction, is associated with silicosis and increased risk of lung cancer. Why not the others? A. Incorrect. Liver cancer is linked to aflatoxin and alcohol, not silica. B. Incorrect. Smoking and alcohol cause esophageal cancer, not silica. D. Incorrect. Bladder cancer is linked to aromatic amines and smoking. E. Incorrect. Colon cancer is associated with diet, APC mutations, not silica exposure. Let me know